With the advent of these new, highly effective therapies, most of the attention has not looked at how effective they are, how this could prevent the future burden of disease, but on their high cost. I certainly wish the drugs cost less because I'd be able to treat more people. But I have no doubts that these regimens are cost effective. Most of the modeling data has supported that it is cost effective. And most of the healthcare systems, for example, the VA, where they have the patient for life, have decided to implement therapy because they believe it to be cost effective. It really comes down to a question as to who's going to bear the cost. Because we have so many patients with Hep C. That's why the cost becomes an issue. We certainly have very, very expensive therapies for cancer, for our biologics are expensive, for rheumatologic diseases, but because the number of patients are so small, that it doesn't impact our overall healthcare system. I think when people saw 4 million people with Hep C, $100,000 a treatment regimen, you do the math, the number gets really big, and people got nervous. However, it's important to remember, we haven't identified 75% of those people. We're not going to treat 4 million people in the next 2 to 3 years. We'll be lucky if we treat the 3 million people to 4 million people with Hep C in the next 10 to 20 years. I think we have to get away from the cost of therapy and focus on the fact that Hep C is a substantial burden of disease in terms of quantity of life and quality of life. It's been shown that eradication of Hep C improves quality of life, improves fatigue, and a lot of other symptoms. It's going to prevent the extrahepatic manifestations of hepatitis C, kidney disease, the increased risk of diabetes, possibly the lower that increased risk of lymphoma we see in our Hep C patients. And it has been shown that cure of Hep C lowers both liver disease and all-cause mortality. So, though I understand the expense and we have to, as a healthcare system, figure out a way to pay for it, I have no doubts that this is cost effective. And it's hopeful that as we have more agents developed, that with competition, the cost should come down further and we should be able to treat more patients. But I believe that every patient with Hep C should be a treatment candidate and that our goal should be eradication of hepatitis C from the United States in as little time as we can achieve it. When the first all-oral agents came out, I think there was a lot of concern because there were a huge warehouse, as people called it, a big group of people who had been waiting for therapy who all wanted to jump on board. And then there was now a sudden surge in allocation of dollars from the insurers to Hep C treatment. I think the difficulty is trying to get it to a steady state so that people can understand the costs. As I said, I think this is cost effective, but finding ways to either amortize the cost, bring down the cost, or are more humane and effective methods than telling a group of patients because their disease isn't serious enough that they have to wait. I can't imagine how it feels to a person to be told, your liver disease isn't serious enough. Let's wait until you develop cirrhosis, and then we'll treat you then. Unfortunately, you'll carry a risk of cancer at that point for the rest of your life. I don't think that would be acceptable to me as a patient, and it's not acceptable to me for my patients. The revolution we've had in Hep C therapy is almost unheard of in medical therapy. It's probably equivalent to when the first antibiotics came out for pneumonia. We went from something in which we could cure, though we said 40% of people, it was really less than 10% because so few patients were eligible for therapy or willing to take a year of interferon as an injection with all of its side effects for such a low response rate. And then virtually overnight, we went from the addition of the first generation proteases to interferon, which doubled the response rate but was toxic, to then, less than 2 years later, all oral therapies that now pushed us over 90%. I find that an enormously exciting thing. I think it shows that once you put your attention to something, we can really go far. Where are we going to be in 5 to 10 years? I don't see that we're going to cure Hep C in my career. It's sad that that's the case because I think it's actually doable. But we have never cured any chronic viral disease with treatment. The only viral disease we've ever cured is smallpox. We see polio is still around. Measles is now coming back. And so it's unfortunate that we're not still working on a Hep C vaccine because vaccination is really the only way that we can eradicate viral diseases. And it requires a high penetrance of vaccination into the public. I've never seen a case of measles myself. My dad, who's a doctor, has, but I haven't. And younger doctors can't even imagine it. And yet we have measles. So I hope that we're going to have highly effective therapies that will become lower in cost, and we'll have better screening efforts that we identify more patients. But I see that in 5 to 10 years, shorter durations, maybe more individualized treatments, but I wish I could be optimistic enough to say eradication, but I don't see that even in 20 years. I'll be happy, and no one will be happier than me if I'm wrong on this one. But if anyone wants to take wagers, they can call me.